How do you decide which doctors to listen to? Trust no one.
Robert F. Kennedy Jr.
President Trump nominated Robert F. Kennedy Jr. as health secretary at a time when many Americans were losing trust in the medical system. I've spent the last year breaking stories about Kennedy's tenure. He's remade vaccine recommendations, phased out some synthetic dyes from foods, and slashed jobs from federal health agencies. I went to Austin, Texas, a stronghold of the Make America Healthy Again movement, to see how Kennedy's influence is emboldening people on the ground, and how some of those people are mobilizing to change policy.
How's it going?
It's good. Good to
Nice
meet
to meet you in
you.
person. Yeah. We launched Make Texans Healthy Again last December. Just trying to leverage this national momentum we're seeing. We were able to pass a total of 25 bills.
Make Texans Healthy Again is trying to translate Kennedy's national agenda into state policy. It supported new laws that will add warning labels to many packaged foods by 2027, mandate nutrition education for doctors, and make it easier to opt out of vaccinating children. In December, multiple food industry groups sued Texas over the labeling bill, arguing it will mislead consumers, but the movement is still pushing ahead.
This is like an issue where moms are really concerned. It's really kind of crescendoed into this movement where people are demanding change.
You want a cold roll?
Yeah.
Okay. Okay.
Tell me what got you into health and wellness initially. So my husband and I got married right kind of in the middle of COVID in June of 2020, and then we conceived our first child shortly after. Once I started asking questions like, what are the ingredients in an epidural? It was a short road to, what are the ingredients in my, in this granola bar or this healthy protein bar? That was kind of the gateway into, I guess, the MAHA lifestyle. Is it hard to have the food standards that you do? I mean, what do you do at a kid birthday party? What do you do, at a school event? Yeah. It is very hard. I showed up to a birthday party once with cupcakes that I made to share. Thankfully, my kids are, I think, really healthy. I think that is in large part to the nutrition they receive. Have you done any vaccines? Are you spacing them out? We have not done any vaccines for any of our children. Can you explain a little bit more about why? Doctors are taught that vaccines are safe and effective and necessary, and I don't think that any of those things are true.
These kinds of doubts about vaccines have become increasingly common, doctors say, and overcoming them can be difficult.
Oh. Let's go back to Mom.
Ready for her shot? Okay. So I've been in practice for 30 years. I do think that with social media and just this pervasive questioning of vaccines in the public domain, more people probably have more questions about vaccines than before. And these are not bad parents, they're scared parents. And that's a big difference. We want to help families not feel scared.
If we do have more hesitancy like that and see vaccination rates drop, what will that lead to? What will happen?
It takes a community who is vaccinated to protect each other. When vaccination rates drop, we lose that community immunity. And you can see evidence of that just with our recent measles outbreak.
The state's largest outbreak in nearly 30 years.
Sadly, a second child has died in West Texas from a measles-related illness.
Public health officials in Texas are racing to address these outbreaks while also dealing with less federal support.
Should parents fear measles?
Measles is very serious. I mean, for some people, it's just a rash that resolves. But for others, it can cause brain defects, it can cause hearing loss, visual loss, and it can have a long-term complication that lingers and eventually leads to death.
With all the changes on the national level and changes here in Texas, does it feel like a losing battle on vaccines?
I wouldn't say it feels like a losing battle, but it definitely feels like a battle.
Kennedy overhauled the CDC's vaccine committee this summer, and the group has started remaking the childhood vaccination schedule, sparking outrage among many doctors and public health groups. His food policy efforts have been more popular, though most of the action this year has happened at the state level.
Why do you think there's been such a tidal wave of interest in this MAHA movement in Texas? I believe that when RFK started talking, I think a lot of us, like myself, got really excited that somebody with a big megaphone is talking about it. And then we realized, wow, there's more of us around.
This movement is real. The mothers don't want to tolerate it anymore.
We have a right to demand that the ingredients in our food is healthy. We have a right to make the decisions for our children in vaccinations. Mostly just freedom and transparency, I would say.
In early 2026, Kennedy plans to introduce new dietary guidelines that are likely to recommend more saturated fats, drawing criticism from heart doctors. In Texas, MAHA supporters are already preparing for the next legislative session in 2027.